All right, it is time for Health Bits, and with me is Robert Nations from Senior Helpers. Good morning.
Hey, good morning.
Boy, have we been looking forward to this topic.
I know, I've heard you and Bob talking about it since last Friday. I think it's
looking
really kind of fun.
Looking forward to it in different ways.
Well, it's really funny because it's interesting. I never heard of it.
I haven't
And here
either.
I'm a 50-year-old man, and I've never heard of it. I didn't know us men went through this process until I met with Dr. Cooperson last week, and we talked about it.
That's just fascinating to me.
So our guest today is Dr. Marshall Cooperson. He's with the Napa Valley Personalized Healthcare. Welcome.
Good morning.
Thank you. Thanks for having me.
Let's start off a little bit, because tell us what Napa Valley Personalized Healthcare is and your approach, because I think it fits perfectly into our subject today.
Okay. Well, a year ago, my partners and I consolidated as a group of physicians taking an alternative approach to healthcare. This is a movement that started probably in the mid-'90s in the Northwest. It's a movement where physicians are trying to take back the practice of medicine. Up until now, probably in the past couple of decades, insurance companies have been exerting their influence more and more and influencing how physicians practice. It's gotten to the point where a lot of physicians are very unhappy with the way they're being forced to practice, seeing a vast number of patients in a short period of time because pretty much the insurance companies hold the purse strings, and that's what has been driving the style of medicine up until now. A lot of physicians, like myself, have become very frustrated with that type of practice. And in 2003, actually, I did some research into this new style of practice and decided that it was worth giving a try. It looked very appealing. It gave me the chance to practice medicine as I was trained. So in 2003, I started my practice of personalized healthcare. And last year, my partners decided that it was a viable and a good way to practice medicine, so they made the transition also.
But the key is, and why I think it fits perfectly the subject today, is you get to spend time with everybody.
Correct.
Because the way I understand the way you guys do things is you do an annual exam and you do a thorough interview of everybody every year.
I can't remember the last, quote, annual exam I've had. Like a physical, is that what you're talking about?
Sure. Yeah.
I honestly, I don't it's been years.
Yeah. Well, physicians just don't have the time. To put that
I mean, you can book it, but they're going to book you a couple months out, and then I don't know.
Right, and like I said, the amount of time
I feel fine
that a physician can afford to give a comprehensive
it's
exam
not going to be
is only 20 minutes to 30 minutes at the most, and you really can't scratch the surface in that short period of time.
And why I think this fits into today's subject is because, and why I think we don't hear much about it is because us men, we don't like to talk about these things.
All right.
Is that?
In part, yes. Andropause is a situation that doesn't come to light much. Men don't tend to express themselves like women do.
Right.
They tend to keep everything inside and not talk about things, particularly when it comes to virility. And,
well, I also, as a man, I don't want to talk about the fact that I'm getting weaker or that I'm tired all the time, and those are all symptoms of this.
Correct, right.
So, this is fascinating to me because I feel like I'm pretty well in touch with a little bit with the health field and all that, but I've never heard of this.
So let's talk a little bit about the symptoms. Fatigue?
Fatigue is one. The most common complaint is a lack of interest in sexual relations.
Yeah, loss of the libido.
Right.
Oh.
That's very common. Other signs might be muscle aches and pains, lack of energy, some depression, night sweats, same thing that women can have.
Do all men go through this?
Not necessarily. It's different for everybody.
Okay.
I don't like to make
because
generalizations.
all women go through menopause.
Correct.
But they do have different symptoms.
Different levels of severity.
Right.
Yes.
So is it the same thing for men? There's a transition, but they...
And it's
it can be
perceived
different.
differently in different men, right?
Okay.
Some men have very profound symptoms. Others, they're very subtle.
But let's talk about what causes it.
Yeah.
Well, as you know, as we age, everything wears out, and the endocrine tissues of the body are no exception. So the parts of the body that produce the hormones just wear over time, and you have just a decline in the elaboration of testosterone in men. There are other pathologic conditions that can cause it, but most commonly it's just a matter of decline in function.
But it's, as we talked last week, the basic thing is you're lowering your level of testosterone in your body.
Right.
And that's what's causing the fatigue, the loss of muscle.
And that's the easiest way to diagnose and monitor the condition is just by measuring testosterone levels in people that have symptoms that are suggestive of that condition.
Gosh, there could be men listening right now, or even women are hearing this saying, oh, that could be what's going on.
Exactly. Because it does cause mood swings as well. I mean, a grumpy old man, as we might have known him in the past, may be the fact that it's this condition.
Exactly.
So when does it start? Is it women typically start in their 50s? Is it the same for men?
In men, it can start anywhere from 40s on. It's more common as one ages, but it can be it can show itself as early as in the 40s. Now, in other conditions that's caused by other pathologic processes, it may show up very young. But those are the smaller number of cases.
But from a health standpoint, I mean, the fact that I'm tired all the time is not a health issue per se. But from a health standpoint, this also has some health factors as well. It leads to obesity.
Osteoporosis. You don't think of osteoporosis as much in men, but it does occur. And sometimes that may be the first presenting sign. Somebody may come in with a vertebral compression fracture and wondering why a male who's not obviously a candidate for osteoporosis would have a vertebral compression fracture. And in the workup, one can find a low testosterone level and address it accordingly.
So based on that, let's talk about how you diagnose it. How do we find out if I've got this?
Well, generally, it's not recommended that everybody be screened for it because that would produce a lot of unnecessary costs in testing. But generally, when people come in with symptoms suggestive of the condition, that would key one to doing a workup. And the workup would include initially checking a total and free testosterone level and seeing where they shake out. And if they are, in fact, even at the low side of normal, in conjunction with the constellation of symptoms, one can diagnose the condition. But certainly if they fall below a threshold in testosterone level, it's a lot easier to make that diagnosis.
So you also mentioned to me, though, about getting your hormones levels checked, getting your testosterone checked.
Correct.
Is that a blood test?
Yeah, it's a blood test.
And then you're getting your baseline PSA, which we all should be doing when we get over 50 anyway.
Correct. Especially for treatment of the condition, which would be testosterone replacement therapy, since prostate cancer responds to testosterone. You certainly wouldn't want to treat somebody with testosterone if they had an underlying malignancy.
What's PSA?
Prostate-specific antigen.
Okay.
And it's elaborated by the prostate, and it circulates in the blood, and it can be measured. And it's some people confuse it with being a diagnostic tool for prostate cancer. It really is just an indicator of whether something is going on in the prostate. But other things like prostatitis or just prostate enlargement can cause an elevation of the PSA.
Oh, interesting. Is that something? Now, is that something that should be tested on a regular basis?
It's recommended that all men from the age of 50 on have a PSA level checked. There's some guidelines that say that once you hit 80 or so, maybe you shouldn't even bother checking anymore. But I tend to want to check my patients throughout their
because people can
life.
live much longer than
Absolutely.
it used to be. So why not?
Yeah, some of those rules about not treating people 80 and 90
like
I think should be put off to the shelf because
I tell you what.
I mean, I read statistics all the time that we're predicted to live to 125. At least my kids could live to be 125. I'm not sure that's a good thing, but that's what I've been reading. So let's talk about treatment options. I've come to your office. We've determined I have Andropause. What do we do about it?
The most common treatment is just testosterone replacement therapy, and there's a number of ways that can be accomplished. We don't like to take testosterone orally because it exposes the liver to testosterone, and that can cause liver problems. So if we can absorb it and avoid the enterohepatic system, we try to do that. So an intramuscular injection every 3 to 4 weeks, or a testosterone patch or testosterone gel that can be rubbed onto the abdomen or shoulders is the easiest.
And that just absorbs into my skin?
Yeah,
that sounds pretty easy, yeah.
There are similar replacement therapies for women, too, for estrogen.
Right.
But I think the key is talking to your doctor about it. Because when I come to the doctor, I tend to come in with what my problem of the day is, and the doctor because he doesn't get to spend a lot of time with me. Unfortunately, I don't get to come to you yet, and I say yet because I'm planning it, is I get 10 or 15 minutes and I talk about why I came in that day. And we usually talk about that symptom and what we're going to do about that. We don't talk about all these other things, which leads me to why I wanted you to talk about your practice, because what you do with your patients in this yearly, you get to know them so well that you ask some very specific questions. You don't allow me to bring to you the fact that my libido's down. I'm not feeling very strong and fatigued. So talk a little bit about that.
Well, in our practice, every patient comes in for a comprehensive annual executive physical examination, at which time we do a battery of blood work, an EKG, and we spend at least an hour and a half to 2 hours with the patient. And we don't use forms for patients to fill out. We ask the patients the questions independently because that allows us to move into different areas when patients respond in certain ways. So with the forms, you're kind of limited to what their response is, and if you even take the time to look over those forms, it might lead you in those directions. But most physicians don't have the time to really evaluate the forms well and take off on the tangents that are necessary to diagnose certain conditions that may be more subtle.
So what's your not everybody can come see you. So, and I don't think you want everybody coming in anyway. What do you recommend we do that we go to the doctor? And how do we bring this subject up? How do we talk about this with people?
Well,
particularly as a guy,
it's important to let the physician know what's going on in terms of one's condition. If you have any symptoms that don't seem to be out of the ordinary, they should be mentioned to the physician, because a lot of times the layperson doesn't know what symptoms are significant and what aren't. So keeping an open dialogue with the physician is very important for diagnosis and treatment of a lot of subtle conditions.
Because the end result is of having this conversation and getting treated, you can increase your strength, your energy level, your mood can improve.
Correct.
And your libido can improve. How much fun would that be?
Not to mention bone density.
Right.
And,
and
maintaining
bone density,
muscle mass.
right. I mean, that's really important.
So I really appreciate you coming in this morning. I think this is a very
Yes.
interesting topic. I'm glad we've been able to talk about it today.
Absolutely.
If you'd like to learn more about Andropause or contact Dr. Cooperson, you can contact them through the Queen Line, which is www.queenline.org, or you can call 1-877-783-3654. And thanks, Kelly, for having us this morning.
Thank you.
And we'll see you September 8th, I believe, is my next time.
All right,
in.
we'll see you then. So that's your Health Bit, sponsored by Queen of the Valley Medical Center and brought to you by Senior Helpers Navigating the Art of Aging. 1440 KVON, 99.3 The Vine. We'll check your traffic coming up next.